Welcome to CEO Intronet. I'm your host, Patty Owens. No industry is changing more rapidly than healthcare, and we're going to meet two executives who will share their perspectives on what those changes will mean for us as patients and what it will mean for us as business owners. Let's meet our members.
Sajid Syed, President, Acro Pharmaceutical Services, Sharon Hill, Pennsylvania.
Bob Fascia, Alliance Healthcare Advisors, Philadelphia, Pennsylvania.
So Bob, let's start with you because you have decades of experience in healthcare. You have watched the pace of change accelerate. What are the biggest changes that people need to know will happen during their lifetime?
Well, during their lifetime, but certainly over
during my lifetime.
Certainly over the next 5 years, Patty. I think we're on the advent of change, which is going to be more dramatic in healthcare than it has been in the history that any of us can remember. The Affordable Health Care Act will go into earnest in 2014, as most of us have heard, but few really understand what it means. And it will impact every facet of provider operations, employer decisions regarding health benefit programs for their employees, as well as insurance companies and the way they operate, the products they provide, and the prices they charge for them. It will impact Medicare greatly, Medicaid to say the least, because that's where a lot of the uninsured will be put into that program by the federal government and the states agreeing to loosen the requirements so that more can come into the Medicaid program. So you're going to have increasing volumes with units of revenue going down on a unit basis, and it's not necessarily going to be a pretty picture.
So I hope it's a prettier picture than the one you're painting, but you know, it's clear that there's going to be an enormous magnitude of change, but I really want to be sure that we're clear on maybe one or two things that will impact patients. What do you think, Sajid?
So patients is, I guess, depending on where you stand is depending on where you sit. So I think I totally agree with Bob that this is an unprecedented reform that's kind of looming upon us next year, and it's really going to boil down to some advantages for some, but will be really some disadvantages for many. So I think we'll be giving up. So I almost see this as two levels of healthcare will probably end up coming, which probably exists in most of the other parts of the world.
So a haves and a have-nots?
Haves and the have-nots.
So do you think the American public is prepared for this?
Honestly, I don't think so.
I think that employers, the mid-size, small employers, 100, 200 employees, are going to find, assuming that the act is implemented as it is written, they're going to find that it may well pay for them to write the employees a check for the amount of money they're spending today on those employees. Let's say for a family, they might be spending, the employer might be spending $14,000 a year. So they'll write the employee a check and have the employee take care of their own insurance, buying it on the exchanges, assuming that the state has agreed with the Fed and they put up an exchange.
Well, you know, that's actually catastrophic because if you think about it, right, hospitals are obligated to treat patients whether they can pay or not. So let's assume that I'm an employee and I have my $14,000 directed my way and I'm reckless with it and I spend it on Botox and I don't have enough left for the day I'm in a car accident and I need more. The hospitals will absorb that. So what's that going to mean for us in general? Nobody's got a good answer for that
one. I'm going to defer to my partner over here on my right for the moment.
What do you think?
That's a tough one, but I think the providers and the payers will really be affected by the impending reform that's coming. Obviously, as Bob said earlier, the volume is going to increase. So there's 30 million new people coming in the pipeline who will have insurance who did not have insurance before. So hopefully that will set some of the losses off. However, your unit of revenue is going to go down. So more work for less money. So all of us have to tighten our belts and figure out a way how to work this together. Otherwise, there's impending problems.
And to go back to your example, they spend it foolishly. I mean, the law does require that everyone have health insurance. So if they spend it on something else, they're going to be in violation of the act, and they're going to incur a penalty. I think you know that you're going to have to, everyone is going to have to file on their federal income tax proof that they have health insurance. That's why the IRS is beefing up so many agents, because they're going to have to, they're going to be the ones monitoring this, assuming, again, it's implemented as it is written.
Yeah, but true, but the penalties are minuscule. You know, if I was a healthy person, penalty is $900. I'd rather pay the penalty and not have health insurance. So I
So
don't
why
think
is
there's-
that not getting a lot of attention right now?
Right.
If that's a fact, why is that not?
I mean, I think the law doesn't have all the teeth. You know.
And they've made an assumption, a lot of people unfortunately don't understand. They've made an assumption that they're going to balance the cost of everyone having insurance by having young folks who are healthy pay some kind of a premium to have insurance, because it's the law. Those young folks, as my partner just said, are going to realize quickly that the penalty is a lot cheaper than the health insurance is going to be.
Exactly.
So their assumption is not, in my view, correct. So the cost algorithm is not going to hold up the way they believe it's going to.
So is this something like car insurance, where there are lots of motorists who drive around uninsured despite the law that they must be insured because the penalty is insufficient to cover
It's a
the
good example.
expense?
I think it's a
Excellent.
good example.
Excellent.
All right,
except
so
that
hello, we've been talking about this for years, right? Well, why am I hearing about this for the first time? Why has this been swept under the carpet somehow?
I'm not sure it's been. There's a lot of disinformation out there about
Okay.
this whole subject, and a lot of misinformation. Disinformation and misinformation, in my humble
And
opinion.
it's really a complex issue. I mean,
It is.
these are complex. I mean, keep in mind. I mean, it's like Medicare. You know, when the prescription plans first came, the Medicare Part D prescription plans first came during the Bush era. It was an extremely complex benefit, and for an average senior to understand that design of the benefit, you know, it takes a lot of reading.
And there are some folks, jaded though they may be, who believe that this Affordable Health Care Act is just chapter one of a move to what I'll call single payer or all payer system, where the federal government takes over the whole healthcare system. I think, or some think, that the ACA has kind of been designed to fail, so that after a couple of years it'll kind of self-destruct on its own, and I won't go into how that's going to happen, but I could. In any case, when it does, they'll rise from the ashes and say, hey, look, we told you the private and public combination doesn't work, it's only the public. And then you're going to get what they call a single payer system, and we all know that means double payer, because, as was already said, you'll go to the public program. If you want to get better than the public program, you're going to pay out of pocket to do it.
So I agree with Bob. I think that's probably the case. We're moving towards a single payer system, and that's what I said earlier, is we're going to get a two-level system, a public and a private.